Hello everyone, welcome to my YouTube channel Nursing Education. My name is Pinky and I am a nursing lecturer. Today I am here with one of interesting topic that is a version, and today I'll talk about internal and the bipolar version. If you want to learn about external version, please watch on a version part 1 video. If you have not subscribed to my channel yet, then please subscribe it and press the bell icon to get more videos. Internal version. So the internal version is always a podalic version. You have seen in the external cephalic version that baby can be brought from a breast presentation to the cephalic presentation, or from the transverse line to the either cephalic presentation or to the breast presentation. But in the internal version, always the buttocks of the baby or the podalic pole of the babies is to brought to the lower pole of the uterus, and after that immediately baby is delivered or baby is extracted of the from the uterus. Indication of internal version. So the internal version is hardly indicated in a single-term pregnancy in present day of obstetric practice, and it is only indicated in the twins pregnancy where the second baby is on the transverse line. However, it can be applied in the single-term pregnancy to avoid the adverse effect where the cesarean section facility are not available or the cesarean section facility are lacking. And such conditions are if the woman's cervix is fully dilated and the baby is on the transverse line, and because in that condition normal delivery is not possible and also the cesarean section facility are not available. And the second condition is a cord prolapse with the cervix fully dilated with the transverse lie or the head is high up and the baby is alive. So in that condition, to save the baby, internal version can be done. There is a certain condition to be fulfilled before performing the internal version, and that is the woman's cervix must be fully dilated to manipulate the baby inside the uterus, because here the hand is inserting through the vagina to the uterus to manipulate the baby. And second one is a Lycot amni must be adequate for the intrauterine and fetal manipulation so that the baby can move inside the uterus and the fetus must be living. Contraindication of internal version. It must not be attempted in the neglected obstructed labor even if the baby is living, because it may cause the bleeding and then rupture of uterus. So the obstructed labor is when the presenting part of the fetus cannot progress into the birth canal despite of strong uterine contraction, and it become neglected obstructed labor when the obstruction is not relieved by the stable hour or day. Procedure of internal version. Internal version should be done under the general or the epidural anesthesia. And before the procedure, assessment of the lie presentation and the fetal heart rate should be measured by the experienced obstetrician, by the abdominal palpation, and the vaginal examination should be done. And also the trans-abdominal or the ultrasonic examination should be done to see the status of the fetus. And then fetal heart rate should be monitored continuously, and the patient should be placed in the dorsal lithotomy position, and the antiseptic cleaning, draping, and catheterization are to be done. Actually, step of internal version. So in the internal version, one hand is introduced into the uterine cavity, and another hand is on the abdomen or fundus of the woman. So in this step first, the introduction of hand is done, and in that, if the podalic pole of the fetus is on the left side of the mother, then the right hand is to be introduced, and if the podalic pole of the fetus is on the right side of the mother, then the left hand is to be introduced. Hand is introduced in a cone-shaped manner, and it is then pushed up into the uterine cavity while keeping the back of the hand against the uterine wall until the hand reaches the podalic pole. So in the picture A, you can see that the obstetrician hand is back of the hand is against the uterine wall. Then along the thigh, the hand should be passed to the breast or the buttocks of the fetus, and the foot of the fetus should be grasped. The identification of the foot is to be done by the palpation of the heel, and the first foot which one is encountered should be grasped first, Then the leg is to be brought down by the steady traction, and then this cephalic pole is to be pushed up by using the external hand, that is on the abdomen. And after the one leg is to be brought down, there is no difficulty to deliver the other leg, and the delivery is usually completed with a breech extraction during the uterine contraction. After the procedure, routine exploration of the uterovaginal canal should be done to identify whether the oomanic uterus is rupture or any other injury has occurred. Bipolar version. So bipolar version is rarely practiced in the present day, and it is also known as a Braxton Hicks version. And in this procedure, the conversion is done by introducing one or two fingers through the cervix, and the other hand is on the abdomen. It may be life-saving procedure at a place, especially in the rural area of the developing country, where it is not possible to transport the patient with the placenta previa to an equipped medical center. And it is one of the chief indication in the lesser degree of placenta previa when the fetus is dead, deformed, or the previable. So as the one or two finger is introduced through the cervix, so cervix must be at least a two finger dilated to facilitate the manipulation. And during the procedure, the by the one or two finger, head is pushed to the one iliac fossa. Here is iliac fossa, and this head is pushed by this one or two finger, and then leg is grasped at the ankle. Simultaneously, the manipulation by the external hand is to facilitate the procedure. And then whirling is a bringing down, which facilitates the compression over the placenta and thereby stop the bleeding. Complication of birth. So complication can occur in the mother as well as in the fetus. In the maternal risk, placenta of rupture can occur during the procedure where the placenta can separate from the inner wall of the uterus before the birth, and which can deprive the baby to the oxygen and nutrient, and it may also cause the heavy bleeding in the mother. Second complication is a rupture of the uterus, where the rupture of the uterus can occur during the manipulation, and this complication can increase the morbidity of the woman. Another is a fetal risk. In the fetal asphyxia can occur, uh, in which where the baby can deprive of the oxygen, which cause unconsciousness and or the death of the fetus. Second complication is a cord prolapse. So the cord prolapse occur when the cord is drops through the open cervix into the vagina, and in this condition, cord can squeeze between the baby's body and the pelvic bone, which can reduce the baby blood supply. And another one is intracranial hemorrhage, where the baby bleeding can occur in the baby of the skull or in the brain, and these all complications can lead to the perinatal mortality of the baby about 50%. Thank you for watching. Please like, subscribe, and press the bell icon to get more.